If we were able to kill 99.9% of germs, we would unleash ecological Armageddon.
What are they not teaching dentists in 2026 that we need to know about?
Practicing in an archaic model based on outdated science, 100% of root canal teeth produce endotoxin. Gum disease gives you a 10 times greater chance for a heart attack, 7 times greater chance of adult onset diabetes, like you're literally choking on your tongue at night. Is make peace with your microbes. They keep you alive.
Hi, I'm Dr.jessicapeatross, and on my podcast, Dr. Jess Unfiltered, we uncover the real root cause of most misunderstood symptoms with help from top experts and real patients who've healed themselves.
All right. Welcome to the Dr. Jess Unfiltered podcast. Today, I'm so excited because I have not only my personal friend, but the first dentist I've had on the podcast. And I picked the best one I could find for you guys. So he is Dentist to the Stars. He is so talented in so many different ways. He's an author of the mouth body connection, as you can see, and it has a new book coming out called The Coherence Code. Dr. Jerry Caratola is one of the best dentists I have ever had the absolute pleasure of working with. He's been my dentist before. He saves my patients from root canals and all the other outdated practices that are out there in the mainstream. And he's really just a breath of fresh air and a wonderful person too. Thank you, Dr. Jerry Caratola, for coming.
Thanks so much for having me. I can't believe I'm the first dentist.
Yeah, well,
I'm honored.
I mean, gosh, I have to go for the best. If I'm gonna have someone on here, I have to set the stage. If you guys didn't know, Dr. Jerry practices in New York. He has a beautiful office on Park Avenue and then also one in the
Fifth Avenue.
Dr. Jerry, I'm excited because we're gonna dig into a lot of the different myths that the regular mainstream dentistry has given us for years. And so I really want to know, what do you believe the traditional dental skeleton and model, is it outdated? What are they not teaching dentists in 2026 that we need to know about?
And, I'm after 4 decades of dental practice, I realize, we're really, we're practicing in an archaic model based on outdated science where, dentists are essentially mechanics of teeth. And medicine and dentistry was, in my opinion, unnaturally divided 150 years ago. So it's like, oh, you want to study medicine? Okay, you go to medical school, and if you want to work in this little 2x2 cube over here, then you go to dental school, and so most physicians, like when you were in medical school, I'm sure you spent like maybe 5 days on the mouth.
Yeah, if that.
If that.
Yeah.
And then dentists, you get one course of oral medicine, and then and then we do a pathology. But for the most part, it is very, there are these blinders on in terms of the rest of the body, and you're just focused on the mouth.
So you just hit on something really interesting. So the mouth is really representative of the body.
Yeah.
How is this? How does this work?
Well, it's really a lot of it is part of the book that I'm writing right now, which is Beyond the Mouth Body Connection and the Coherence Code. The Coherence Code refers to alignment, and it refers to, we are healthy when we are coherent, when our entire system is coherent, in mind, body, spirit coherence. And we look at that coherence in biologic medicine on a microbial, biochemical, energetic, psycho-emotional, and spiritual plane. What's interesting is the most important area for regulation or coherence, both for vagal nerve, the vagal flow,
Yes.
which is from your brainstem to a third of your colon. The center of coherence is right here. Energetically, they call that the throat chakra,
Mhm.
and, but we actually know that your mouth is an essential part of both your ability to regulate. So there's so many things that happen in the mouth for the regulation of your immune system, for your oral microbiome and the production of nitric oxide, for even, and then energetically, people with TMJ dysregulate vagal energy flow, vagal nerve energy flow. So they call the bridge of coherence actually from the throat, from this area to the heart. The heart here is often referred to as the bridge of coherence. So I find this really interesting because, we've been stuck in everybody knows about, we hear a lot about the microbial world. We fight infections and, our understanding has changed dramatically there as well. I spent a lot of time studying the oral microbiome over the past 30 years. And, but in addition to that, we also know about biochemical regulation and hormone dysregulation, that kind of thing. When we start to get to the next three levels, the next three planes, and we talk about energetic flow,
Yes.
and now we start to get into the world of woo woo, and a lot of people are like, "Oh, that's woo woo." The first time I actually did the Harvard Medical School program in complementary and alternative medicine back in the late '90s. It was only around for a few years also. It was that Dr. David Eisenberg put these symposiums and programs together. It was open to all healthcare practitioners. So it had even said dentists, chiropractors, da, 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 all this stuff.
Wow.
So I get up to Boston first day, right? It was like a summer programs. And I get up there and there's a guy sitting next to me and he goes, "Hey, I'm Bob so and so." And I said, "Hi, Bob, I'm Jerry Curatella." He said, "Hey, Jerry, what do you do?" And I said, "I'm a dentist." And he looks at me and he goes, "What are you doing here?"
No one got
And
it.
I was like, "Well, Bob, like you'd said open to all healthcare practitioners. I didn't feel like the orphan." And I said, "But guess what, Bob? What goes on here has a lot to do with what goes on there, which is how this book came about." This
Mm.
book came about after that program because I realized most people don't understand that your mouth is a mirror of what's going on in your body. Like 86% of
Mm.
infectious disease has manifestations in the mouth, but it's a very, very, very serious gateway.
For
And
sure.
and you have dysbiosis in your mouth, periodontal disease. You dysregulate on a microbial,
Mm.
biochemical, energetic, right down that line. So I routinely, when I examine patients, I routinely tie all of those 5 dimensions of regulation and healing together, and most of them go, "Wow." I even write down to if I'm, like, for example, treating a cavitation, I'll ask the patient, "Do you believe you're gonna get better?"
Yes.
And I had a patient with chronic Lyme disease who had giant cavitations, and, she couldn't get over her Lyme. And, it was Dietrich Klinghardt, well-known MD in Seattle, who actually came out and said, "You're never gonna get over your Lyme disease if you have these osteonecrosis in the jaw where these pathogens can harbor and stay for a long time, where there isn't a good blood supply, it's warm, it's dark, and it's moist." So she was there and she looked at me, and she's from Washington, DC, and she actually started crying and saying, "I don't know." And I said, "Well, Erica, the truth is that if that's what you're telling your body, you are not going to be able to regulate and heal." And so she actually pulled the book out. I said to her, I said, "Faith is believing in what you can't see, and it's the substance of things that you hope for." And I said, "You got to believe. Bruce Lipton, a renowned cell biologist, wrote a book, The Biology of Belief. What you believe changes the way your cells express
That's
themselves.
right. That's right. You have to believe.
So you got to believe." And fast forward, this woman, after I treated her cavitations, um, fully recovered,
Oh.
and she was bedridden with 2 small children, fully recovered after she had her cavitation treated, but a big part of it was, I stopped her right there, and I got her to understand that the psycho-emotional component of healing,
Yes.
we manifest what we believe.
Yes.
If we believe that we're gonna be s and people who have chronic illness struggle with this all the time.
All the time. All the time. It's really a roadblock.
Yeah.
So I have to ask for everyone out there listening who may not know about holistic or biological dentistry, they're like, "What the heck is a cavitation?"
Right.
Can you
Yeah,
explain that?
cavity is a cavita first of all, cavitation is a made-up word, and, we didn't hear it in dental school. It was actually an orthopedic surgeon in 1931 who was dissecting the human jaw and found these dead areas of bone where teeth may have been removed in the past. It's an area of dead bone and what we call, JON, jaw osteonecrosis. Now, how do you get jaw osteonecrosis? Well, so many times what happens when we extract a tooth, at least what I learned in dental school, you extract a tooth and we're like, well, the gums grow over, the bone fills in, and everything's groovy.
Mm.
And what we know, and actually the technology advancement with 3D cone beam, which everyone should get one in their lifetime,
Yes.
a CBCT. Um, it's cone beam computerized tomography. It's a 3D scan with it's digital, so there's much less exposure than a medical CAT scan of your brain or your lung or anything like that. But there's an enormous amount of diagnostic information. Most importantly, we can see in 3D. So when you can see in 3D, you see things that you couldn't see in a 2D little x-ray of a tooth that's superimposed with the cortical bone on the outside of the jaw and on the inside. So you really don't see a lot on a 2D that all of a sudden on a 3D is a completely different story.
Yeah.
And so a cavitation, the ability to see these, I would start reading these 3D cone beams, and it was like, whoa, what's that big black area around where the third molar was taken out? Because what we know now is that bone in the jaw, the cells that make new bone, the osteoblast, need support. They need a scaffold.
Yes.
So I always compare it to like the scaffold on a building, on a building in Manhattan, when they're repointing brick. You put the scaffold up, repoint the bricks, and then the scaffold comes down. So what we do now when we treat cavitations is we will actually clean out those areas, disinfect thoroughly, and we have some great tools to do that. And then we graft it and close it and get it to regenerate and heal. So now we eliminate what is essentially a petri dish for pathogens.
So really anyone who has a tooth removed has a risk of getting a cavitation,
Yes.
really?
Yes,
And this is quite common.
very common.
Okay.
And people should know whether they have them or not.
And are there any signs or symptoms, or is this pretty silent?
Very often it's a stealth infection. It's pretty silent.
Okay.
And there'll be like weird stuff. Like for example, depending on what tooth number, because every tooth is created energetically, there's a connection from every tooth to every organ system in the body. So from your brainstem through every tooth. And by the way, the first time I saw this tooth organ relationship chart, I was in the Harvard Medical School program. This guy puts this thing up, and I'm like, "That's voodoo.
Woo-woo,
That
great.
is voodoo." And I was like, "No way." And then it was like, "Yeah way, yeah way." Well, I mean, acupuncture goes back thousands of years, and so they've done open heart surgery with acupuncture, and like there are I have an acupuncturist in my office in East Hampton, and she will put points in and literally take anxiety, pain,
Yep.
amazing, even blood flow.
Huh.
If a patient is having a surgery to control blood flow, you can even use acupuncture to modify blood flow, which is amazing.
Amazing.
But I mean, so this is a system of medicine that's what, 2,000 years old?
Yeah.
And then the Chinese knew about meridians through the fascia, from thousands of years, and we're just catching up.
Yep.
So now you have orthopedic surgeons using acupuncture, and you have plastic surgeons using homeopathy, and you have, we're starting to, at least there is a subset of practitioners that are more integrative.
Yeah, that reminds me actually. How did you, as a conventionally trained dentist, figure this out? Was it that Harvard conference you went to? How did you put all this
Now,
together?
1983, I graduated dental school, and I tell everybody it was Doogie Howser. I was 6. No, not. Um, I came out of dental school, and a classmate of mine, I was always intuitively, it was definitely innate, and dentistry was a calling, as a matter of
Yes.
fact. In I'm going to take this because I have to show everybody. In my book, this is the business card I made at 6 years old
Oh, wow.
to become a dentist. So at 6 years old, was the calling. And then when I was finishing dental school, I was like, I don't want to be a mechanic of teeth. I want to feel like a physician of the mouth. Now, my older brother had graduated medical school. And I remember I was applying to dental school, and I told my father I was applying to dental school, and he goes, you know, why don't you be a real doctor and go to medical school? It's the same number of years, be a real doctor. And I remember my mother going, he has a DR.
Yeah. Yeah.
And I was like, Dad, this is what I want to do. This is what I feel called to do. First of all, I was always creative. I always loved to work with my hands. It was part of my left-handedness was the artistic side,
Mhm.
which was the right brain, which was music and art and design. And I love to. I was an art minor in college. I did sculpture,
Oh, wow, makes sense.
so
Okay.
that turned me on.
Yeah.
And then the left brain was the science, and that's how I did the really deep dive in the microbiome when I came out of practice. But part of the science side of me said, I don't want to be a mechanic of teeth. I want to be a physician of the mouth.
Mm.
And when I came out of that Harvard program, I remember in the morning when I was doing a morning meditation, I was like, you know what? And two things came. I was like, my mission in this lifetime is to change the way dentistry is practiced and to change what people use to take care of themselves in the mouth and do a toothpaste that actually is not a detergent, but it is something that, helps the body heal itself.
But how did you know that? How did you know that bacteria weren't all bad in the mouth?
I was mentored in that. That's an interesting story. I was mentored in the microbiome, which we used to call the microbiome is a made up word. Also, it was Josh Lederman in 2002. He was a Nobel laureate who coined it. It was 2002 or 2006. He coined the term microbiome because it used to be biofilm.
Hmm.
So everything was the oral biofilm.
Interesting.
And our orientation was kill it, kill germs, kill plaque, kill plaque, kill plaque, kill plaque. It was like everybody parroted the same thing.
Right.
And oral care still struggles with that understanding because they're still like xylitol kills strep mutans bacteria. You gotta get rid of them. Gotta get rid of them. And really, strep mutans are commensal. They're community bacteria that live in your mouth.
Mm.
They cause cavities when they're out of balance, when you piss them off. It's kind of like the way people behave. You know?
Yeah.
Right? You
Yeah.
mistreat people, they form gangs and ghettos, and next thing you know, you got a war going on, and then you're fighting a war that you really don't know. What we really need to do is, that's why my mantra is make peace with your microbes.
Ah,
They keep you alive.
yeah.
They literally keep you alive.
So the conventional dentistry that's saying kill everything, and I still hear them parroting that, is really different from what you're trying to do with Revitin, the
Yeah.
toothpaste, and everything you're preaching to patients.
Everything. For example, what are the big trends right now? Xylitol has been promoted as anti-cavity, great for the microbiome. No, it's not great for the microbiome, everybody. It's very disruptive,
Interesting.
okay, because it disrupts plaque. What you want to do, plaque is an unhealthy expression of the microbiome. So what they're doing is they're treating the symptoms and not the root cause.
Okay, that makes a lot of sense then. Because what you're basically saying is the microbiome in the mouth, it's supposed to be there. We need these commensal bacteria that we've labeled as bad, black or white. But nothing's black or white. It's more of a gradient and it's about the terrain.
Terrain.
Okay.
It's all about the terrain. So really our understanding, the Human Microbiome Project has is so revolutionary in as a scientific advancement. The Human Microbiome Project and our understanding of this world of the microbiome, which we can talk about, is as unique as when Copernicus said the Earth isn't the center of the universe.
Mm,
So they call it a Copernican revolution in science. Why? Because guess what, everybody? We're made of microbes.
that's right. They're not.
I was giving a lecture in Austin, Texas, and I was saying, there's that verse in the Bible where God in Genesis chapter 2, verse 7, where God said, God took from the dust of the earth and breathed his spirit into it, and we became mind, body, spirit. No, no, no. And I was like, well, whether you're a creationist or an evolutionist, somehow I don't think, you know, why would he take dust, like the stuff my mother would clean off the bookcases in the den, you know? And so this guy who was a biblical scholar, oh, no, he was a scholar of Torah. He was a Jewish scholar who studied the ancient text, Hebrew, Aramaic, and everything. And he's like, you're absolutely right. The word is not dust. The word translates loosely to slime. And as a matter of fact, one of the earliest Bible, the word in that text um, is slime.
So we come from
So
slime.
we come from slime. The earth was covered with microbial slime. And there is this whole mitochondrial bacterial theory where God took from the slime microbes, became engulfed in a cytoplasm. So if you look at a mitochondria, which is the energy factor of our cell,
Yeah.
and you look at a bacterium, they're the same
They're the
shape,
same.
they
Yeah.
divide the same,
Yep.
they contain the genetic information.
Yep.
So if you think about it, could it have been in that act of creation that those microbes became engulfed in a cytoplasm, then organized into tissues and organs and da 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 da, and here we are. And by the way, everyone, the number of microbes in and on our bodies as you and I sit here right now outnumbers our human cells by 10 to 1.
So we've been just really maybe falsely incriminating these guys for years, which kind of brings me to my next question. What are we doing with antibacterial mouthwash then?
Ah, antibacterial mouthwash. I mean, they have my picture they have my picture on a bullseye of a target at the Listerine headquarters. I think I had something like 20 million views
Oh my god.
on a post I did about because I picked up a bottle of Listerine that kills 99.9% of germs. And this is what happens. And this is what really makes me angry is when consumer products companies continue to use junk science.
Outdated.
And then I get these comments, you're scaremongering, you're because I said, I go, if we were able to kill 99.9% of germs, we would unleash ecological Armageddon. Because guess what? Your oral microbiome protects you from deadly viruses and bacteria in the environment around us. Number two, your oral microbiome produces nitric oxide, essential for cardiovascular health, nervous system, immune system,
Beating COVID.
beating COVID. Thank you. Um, so what we have is this false and misleading advertising. That's the scaremongering. Scaremongering is saying, kill germs when they know that there's no such thing as germs. There's good bacteria and bad bacteria, but bad bacteria are good bacteria that are pissed off.
I truly believe that too. That's what I've seen same thing with like stomach acid too.
Yeah,
Right? It's a flip-flop of that as well. And
definitely.
yeah, that's really interesting that you say that. So people who are using regular, mainstream, off-the-counter antibacterial mouthwash are literally risking high blood pressure.
They're dysregulating their immune system. They are risking high blood pressure. They're interfering. They did a study, and this was there because I had one of the dental societies, the ethics committee of the New York Dental Society or something, sent me a letter saying that I was from the Council on Ethics, saying I was making comments that were not, based in, I forget how they worded it,
You're
but basically saying
misinformation.
it was unethical and I was giving disinformation.
Yeah, yeah.
That mouthwash has a long history of efficacy. By the way, mouthwash does nothing for oral health. It just gives you fresh breath. Why do people need fresh breath? Because their microbiome's out of balance.
Yikes. So the
So they
halitosis is
use
coming from here.
you use something like this. This product is, and the origin of this came from the fact that I was like, wait a minute. Toothpaste was invented by soap makers 150 years ago. I was on the Martha Stewart show, and she's like, "Tell me about your research in oral care. I know you're working on the origin of Revitin as a prebiotic was really as a nutritional first." And I was the thing like I there was a study from Japan in the 1970s that showed that there were two key nutrients that were necessary for proper cell function. They were studying disease gums, and they found that number one, vitamin C, and vitamin C has always been a favorite of mine because we know that scurvy, sailors with scurvy, they were deficient in vitamin C, which is a really gross gum condition. Um, and then the other one, very interesting, which a lot of people didn't know a lot about back in the 80s, but it was coenzyme Q10,
Oh, yeah.
which is a cofactor in the production of ATP, which is the energy in the tank. So they found that the organ systems that needed the most amount of ATP, and hence CoQ10 for the production of that. And we know CoQ10 levels go down in the body as we get older,
Yes.
our production of CoQ10. So we do need to supplement. But they found that the heart, skin, and your gums need a tremendous amount of ATP, the most amount of metabolic
Huh.
function.
Interesting.
Heart, boom, 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 boom. Skin, largest organ system in the body, gums. So I started playing around with vitamin C and CoQ10 in a paste with vitamin E and this and that. I had my wife rubbing it on her gums, and she had this gingivitis problem. She'd see the hygienist like every 2 months. Next thing you know, her gums stopped bleeding. And I was like, that's interesting. Oh, I guess we got to feed your smile, feed the gums. So my thinking about, without knowing anything about the microbiome or the biofilm back in 1997, I didn't know anything about biofilm. I thought were bad.
Yeah.
You got to kill them.
Sticky
You
substance.
got to eradicate this.
They
That's that
live.
grimy feeling on your teeth in the morning.
Mhm.
That's, sticky, smelly film on your teeth that you don't even want to kiss your significant other when you get up.
Yeah.
Well, guess what? You use Revitin for 3 days. You go from a high film thickness, which is an imbalanced state of a thick, sticky, smelly film, to a thin, clear, odorless film where you don't have bad breath. Your teeth get whiter, your breath gets fresher, all as signs of a balanced microbiome.
So what I'm hearing you say is really good toothpaste or mouthwash or anything for oral care is going to help balance the bacterial ratios, which is really what causes the bad, nasty biofilm is the ratios of the bacteria are out of balance or mad, like you said.
Yes.
Okay.
Yes,
Interesting.
and that's part of coherence. If
Mm.
you think about it, we're in such an amazing incoherent period in our history, politically, economically, environmentally, but even people are incoherent with each other.
Yes.
They don't, you look at even in our government, nobody's reaching out and talking to each other. It's all polarized.
Yeah.
And that is called incoherence. And that's why this theme, which I started with in the mouth body connection, I talked about, 4 pillars of oral health, and the four pillars of oral health were, you know, um, uh, nutrition was the cornerstone. So I talked about alkalizing, anti-inflammatory, antioxidant rich.
Mhm.
Whether you are keto, paleo, Vigo, pescatarian, fooditarian, whatever you are,
Yeah.
the concept was alkalizing, anti-inflammatory, antioxidant rich, what I call triple A nutrition in the book. The second thing was about regular exercise, not just for your body, but for your mouth. Believe it or not,
Huh.
exercise helps with the production of short chain fatty acids that are anti inflammatory in your mouth, helping to restore coherence.
Yes.
Um, Stress management. What happens with stress? You grind, you clench, you get TMJ, you lose vagal coherence.
Yeah.
Um,
You can't
and,
swallow pills,
and
right?
can't swallow pills.
Yeah.
And in addition to that, management of stress, you helps with the production of short chain fatty acids, which are anti-inflammatory. So managing stress helps to restore coherence to your mouth, to your body, mind, body, mouth, spirit, you name it. That's where people have to get out of their heads and really understand how to, manage stress. And then the final one was get the junk out of your medicine cabinet, and really restore coherence in your mouth. And that was a big thing about this prebiotic approach. Probiotics, by the way, were tried back in the 70s in the mouth. They were not effective because your oral microbiome makes it very inhospitable
Huh.
for any foreign microbes to set up shop, good or bad.
Huh.
So I was like, if probiotics worked in the mouth, so would conbiotics like E. coli and salmonella and all that, which you generally don't see E. coli or salmonella setting up shop in the mouth. In the gut, yeah,
Mhm.
but that's a closed system, and that's where probiotics have more effect.
Right.
There are newer probiotics that are coming that could be supportive to this overall community. So I'm really starting to adopt a pre-pro because the work back in the 70s with probiotics was much more primitive than the technologies that are evolving today. It's really important that we nourish and support the indigenous flora of the mouth, what we call the oral microbiome.
Yeah, very it's actually key and center point in everything, right? There's a
Yeah.
microbiome on our skin, in our gut, in our mouth, it's everywhere, right? So we have to be nice to these bacteria. You know, I wanted to touch really quick on mouth breathing. A lot of people know that it's bad now. We have a lot of people mouth taping every
Right.
night. We have a lot of people with these high arches, narrow palates, all that kind of stuff, and they don't know what to do. There's a lot of misinformation about there. Do you move the mouth and the teeth at the right time? Do you do an expander or not? Is this going to hurt my nervous system? How do you triage that?
So the first thing is, everyone should have 2 tests. I told you one already. I gave one away. CBCT. As a matter of fact, we're gonna do a special code for you to read for your people, the Dr. Jess unfiltered people will read your cone beam because a lot of dentists are not well trained in reading it. It's a new technology.
Yeah.
A lot of dentists use it as a diagnostic tool to see whether they have room to put an implant in. So you don't hit the sinus and you don't hit the mandibular canal down here. But there's so much other pathology that we can see,
Mm.
including your airway on a 3D cone beam. We can see your airway. But the second test is a home sleep study, a watch. It's called the watch pad.
Ooh.
And, I did a sleep study back, I don't know, like 20 years ago. And my brother's cardiologist was like, "Oh, I want you to get a sleep study." And I was like, "All right," because he said, they found I had obstructive sleep apnea, OSA. And, uh, and we're different. We don't even look alike, my brother and I. It was so funny, but we sound alike, but we don't look alike. And he had more severe sleep apnea. And a lot of that, out of the sleep. So the old way you did a sleep study, you went to a sleep center and they hook all these electrodes up and there's fluorescent lights in the wall and you're sleeping in a hospital bed and it was like, get me out of here.
Yeah.
So there is now a kit that we can send our patients and it's a little disposable kit. It's got a plastic wristwatch, kind of like this. And it's got a sensor like a blood oximeter measuring blood oxygen level, heart rate and everything. It's got a sensor on your breastplate, and that we can tell what side you're sleeping on. Basically, we get 7 pages of respiratory data, and from that, we know whether you are mild, moderate, or severe.
Okay.
Now, you mentioned mouth taping, which I'm a fan of, also under one condition that you do not have a deviated septum, that
Mm.
you do not have obstructed breathing because of a respiratory issue. The reason I'm a fan of mouth taping is we can train you to breathe through your nose, which helps with the production of nitric oxide, and also prevents a lot of other problems because dry mouth is linked to a lot of periodontal gum inflammation, so gum disease, tooth decay. It's like gasoline on the fire for gum disease and tooth decay when you breathe through your mouth at night.
Can that change the shape of your face?
Yes.
Really?
Absolutely. So, a lot of times, the reason people breathe through their mouth is they may have a tongue tie, other than respiratory, upper respiratory, where you have a deviated septum and or something like that, adenoids and large adenoids and
Mhm.
things. So, um, really breathing through, if you can breathe through your nose, then what we would look for is a high voltage palate. A lot of times, believe it or not, 80% of OSA, obstructive sleep apnea, this, what we call upper airway disease
Mm.
or, airway resistance is because of past orthodontic treatment, extraction therapy. So believe it or not, orthodontists were really big on like, oh, we got to get your teeth straight. Oh, we got to take your 4 bicuspids out, your 4 wisdom teeth out. Now they're missing 8 teeth. And then they do orthodontics to shrink the jaw. And so a friend of mine, and, I always quote his book. He's a really nice dentist, a biologic dentist, Dr. Felix Liao, wrote a book called 6 Foot Tiger, 3 Foot Cage. And I love it. He's Chinese, so everything is like Crouching Tiger. Felix, great title. The book's a little dry, but the title of the book tells it all.
Yeah.
What happens when you have extraction therapy or if you've had orthodontics when you were young and they took teeth out to make, quote unquote, make room to align your teeth, they may have shrunk the cage. So your 6 foot tiger is your tongue. Your 3-foot cage is your mouth
Ah,
and or the arch, the dental arch. So really the tongue is squished into the space, forcing the tongue to sit further in the back of the throat, obstructing the airway.
oh, wow. Okay.
Tongue tie. Tongue tie is a big thing. Unnaturally holding the tongue down. It's that ligament under your tongue,
Yeah.
that can be unnaturally taut. We call that tongue tie, and it will unnaturally keep the tongue further back in your throat, like you're literally choking on your tongue at night. These are people who can't sleep on their back, they have to sleep on their side. What's the other sign of obstructive sleep apnea? Your palate, high voltage palate.
Mm.
So high voltage palate, we breathe through this triangle where my thumbs are, my fingers are. When you have a high voltage palate,
Oh, wow.
you have a restricted upper airway.
So like this.
Yeah, so this is all upper airway resistance.
Huh.
So what we want to do and what we do is a lot of times we will help to we have an appliance. This appliance is called the DNA appliance, which helps with the expansion of the arch, make room for the tongue. Release the tongue tie, make some room.
Mm.
We can do removable aligner therapy. We can use this DNA appliance. There's different ways that we can improve the airway by improving the room, giving your 6-foot tiger a 6-foot cage.
And it's important because for people thinking, why does this matter? It's like the way the teeth touch and the way where the tongue goes talks to the nervous system of your body, right?
That's another very good point. So the rest position for the tongue should be basically on the upper toward the upper jaw and resting right behind your upper front teeth.
Okay, I'm
So
doing.
if you have tongue tie, you can't get there.
Mm. So it's
So
further back you can
yeah,
touch.
and if you
Okay.
have a really high palate, everything starts to be off, and then you have a restriction above that, so it's harder to breathe through your nose.
Mm-hmm. And that
And
puts the body in flight or fight, right?
right,
Yeah.
exactly. And that's why a lot of people who have TMJ or clenching and bruxism, that's usually a sign of airway disease
Interesting.
because when the brain is people have to get up and pee in the middle of the night
Yeah.
because they lose their continence around their bladder. Bedwetting in children is a sign of obstructive sleep apnea.
Wow.
Hyperactivity disorder in children, could be a sign of airway disease, obstructive sleep apnea. So this happens very, very young. And for adults, a lot of times they will, there's a host of things, but it's linked to hypertension, type 2 diabetes, cardiovascular disease, stroke, dementia.
Wow.
Yeah, a lot of really, really things that you would never think were connected
Yeah.
to airway disease.
ADHD, like, is it just they're not getting enough oxygenation to their brain? Is that what's happening?
Yes. 3 things we need to live, right? We need food and water, we need oxygen, and we need sleep.
Yeah.
And so what happens a lot is, with this kind of obstructive sleep apnea, we have an issue where your brain goes crazy in the middle of the night. You stop telling. There's 1 billion people on the planet choking in their sleep.
Oh my
Yeah,
gosh.
and they are literally most of them are undiagnosed.
Yeah, I can't tell you how many times I've seen people with sleep apnea and they didn't have the body habitus or a reason for me to say that I would never think they would have a diagnosis like that. It's always something obscure like this.
That's why the best thing that you could do is let them get a home sleep study and let them get a cone beam and let them get a virtual consult. And that's what we do. We do that and it helps patients. And then we'll help direct you to a biologic dentist near you. But a lot of times they're like, oh, I want to go to a biologic dentist. And they go in there and they start clicking around. And it's some dentist who, decided to join the club. And, he goes to like an IOMT meeting and, now he's biologic.
Yeah.
So the certification, the credentials, they vary, and
Mhm.
it's one of the reasons why I'm establishing this institute, which hopefully will be at NYU, and we can really train people in the principles and protocols of this because biologic dentistry is good dentistry.
Yes.
It is a higher level of consciousness. It is a more conscious way of practicing where we look at root causes. We do not vary from the standard of care. You do a lot of the things that you would do in dentistry. you know,
Mhm.
but you do it with an understanding of both the connections to the body
Mhm.
and from the body,
Mhm.
in the work that we do. It's really bringing dentistry and medicine back together again.
As it should be. It's been separated just like different organ systems and specialties have been separated. That's not
Absolutely.
correct. The body works as a whole. So I really appreciate this point you're making. So obviously all dentists are not created equal, just like all doctors are not created equal. And unfortunately, a lot of just conventional dentists that haven't been trained properly and still keep the outdated science, they make a lot of my patients sick. So I know pretty much like a patient profile of someone who has maybe an infected root canal or mercury toxicity. If you were going to tell people out there listening, hey, I suspect you might have a microbiome or it's some sort of teeth issue, what would that patient profile look like? What kind of
Well,
diagnoses will they have?
it's really interesting because that's a really loaded question because you covered a lot of things.
Yeah.
Because I want to talk about root canals
Yes, let's go.
because I get a lot of haters, the dentist haters, but
Let's go there first then.
dentists who are haters. So
Yeah.
to give you an idea, modern root canal, modern endodontics has only been around since the end of World War II. And honestly,
Mm.
it is a procedure that can get a patient out of pain. And the big thing is, we as dentists are in the job of keeping your teeth in your head, save the tooth.
Right.
And I do have to say that, everybody's like, "Oh, you hate root canal, you hate root canal." No, no, no. What I think root canals can be mechanically successful,
Mhm.
and the patient does not have pain,
Mhm.
fever, or swelling. No, the moniker or the markers of success of a dental procedure is, um, it stays in the head, it doesn't hurt, it doesn't hurt, and insurance will pay for it, like or whatever.
Yeah.
Uh, and the reality is that where a root canal may be mechanically successful, it does not take into consideration the inflammatory burden that may be created by that procedure over time. And when I say over time, I'm talking about endotoxin production, which is well documented in the literature, in the scientific literature, in PubMed studies and everything. 100% of root canal teeth produce endotoxins, which are bacteria and bacterial byproducts that are inflammatory to your immune system and that are also a dysregulating to the immune system. They can dysregulate. So what does that mean? It means that there can be problems downstream with that. So what do I recommend? I recommend if you've had root canals
Mhm.
on a CBCT, which I am training, and I have a very well-trained group in my practices, but I get CBCTs from all over the world, and I read them every day, and it's a major aha moment for a lot of patients. And because I can see areas of cavitation. I was giving a lecture in Newport Beach, California, on biologic dentistry to functional medicine doctors. One of the functional medicine doctors there, a woman named Deborah, called me on Monday morning in my office. She said, "Jerry, I saw, I loved your presentation. I learned so much, but I want to tell you that one of my girlfriends I grew up with was just diagnosed with a lung tumor, and it's aggressive, it's large, they're talking about taking out her lung." And I was like and she's like, "What do I tell her to look for in her mouth?" I want her to get screened dentally, you know? "What do I tell her to look for?" I said, "Well, honestly, ask her if she has any root canals." And um, this was before COVID. This story is, one of those stories that was like a confirmation of the path that I've been on. So, of course, she, calls, Deborah back, and she had 1 root canal, and it was the lower left first molar. What are the meridians right below the lower left first molar? Lungs, colon, root
Yikes.
canal, lower left first molar. So I said, "Deborah, tell Lisa to get a cone beam and have it read and see if there's a cavitation forming around that root canal." She goes to her general dentist. He does an x-ray. The root canal looks perfect. And really on a two-dimensional film, the root canal did look perfect.
Always,
It
always.
looked like, oh, look, look, feel, because the idea is it's taxidermy, right? It's really taxidermy on a tooth. And, as Jabin says, it's a zombie tooth.
It is a zombie too.
Jabin's like, it's a zombie tooth.
Yeah, it's a
And I'm like, I never thought of it like that. But, because we thought, like in dentistry, because we're so mechanically oriented, we thought like, a tooth is like another piece of bone in your head. No, it's an organ system. It has a circulatory system, a nervous system, a lymphatic system, a skeletal system. I mean, it is a living, breathing thing. It's not. But anyway, when we do root canal, we take all the guts out and then we file it and clean it. We use this bleach in there that only goes, 100 microns or even less. I think it was 10 microns. I think with a laser, with the bleach, you can go further, or ultrasound. We do all these things to try and disinfect the tooth. So problem number one is you can't sterilize a tooth. That's problem number one.
Mm-hmm.
Problem number two is anything dead in the human body will necrose.
That's right.
Okay, so that means it's going to decompose in your body. That's why when you take out an old root canal, it crumbles like dust.
And it
Like you
smells
take
like
it out as
death.
piece, and it smells. I mean, routinely we take it when we remove an infected root canal. We send it out for pathology sampling, and we see parasites, mycotoxins, all this stuff.
And you know what kills me? When you put bleach on mold, it makes it worse. It makes it produce more
I didn't
mycotoxins.
even
So
know that.
I wonder, yeah, never use bleach on mold. Never is a big no-no. So I wonder when you're using bleach on these microbes within
Bleach on mold makes it worse.
yes. Yeah.
Wow. I learned something new on Dr. Jess Unfiltered.
Come on,
Dude,
everybody. Yeah.
learning is a lifelong experience, Dr. Jess.
That's right. But then that makes you wonder if you're putting bleach inside the tooth.
Right.
What is it
Well,
actually doing?
it's unbelievable. I can't believe that because mycotoxins are a huge common finding when
Really?
we take out endodontically treated teeth.
Really?
Yes. I'll show you the pathology reports. But let me get back to this patient. So she goes to two general dentists and then a root canal guy. None of them have a cone beam or do a cone beam. And so she's totally frustrated. She comes up to me. And by the way, they have her in the queue for surgery in Texas,
For her lung.
U at T.
For her lung. Right.
For her lung. They were
Yeah.
talking about taking out her lung, okay? She comes up to me, and this is tooth number 19, which is the lower left first molar, big tooth, right? And the first thing, if you look on the tooth organ meridian chart, which you can Google that, tooth organ meridian chart, and if you look, right below that tooth, it says lung and colon.
That's
Because your lungs and your colon are on the same energetic meridian. So anyway, I do the cone beam, and lo and behold, she has a giant black area behind the two roots. So you would never see that on a conventional X-ray.
like a tooth.
But in 3D, like for example, a 2D X-ray, you have bone here, and where my head is where the problem is. So on a 3D, you can look at different orientations. What we have is a cross-sectional orientation, longitudinal, axial from the top.
Yes.
So really you can see in 3D.
Yes.
And she had this big black area, and I said, Lisa, this tooth should be removed. This tooth is failing, and we need to disinfect the bone, and we need to graft this.
So it was eating away at the bone.
Eating away at the bone, correct.
Okay.
And literally, it was a pathogen party. So it was like party,
Yeah.
a
Yeah.
giant disco going on in there.
Yeah.
And I took the tooth out. I disinfected the bone. I grafted it, closed, kept her for a few days, monitored her healing, and then sent her back down to Houston. She shows up 5 weeks later. And this is the part that blew my mind. 5 weeks later, she's in her pre-surgical workup. They do another scan of her lungs, and they're outside. She's in there. They're outside the door, and they're going from film to film, film to film. And they're like, "Guess what? We can save your lungs. We can save your lung." Like they're saving the lung. And she's like, "What's going on?" She said, "Well, we don't know why, but the tumor has shrunk to 25% of the size." And I would have been like, "Okay, fellas, see you in another month. Let's see." Because here's the deal. Doctors don't heal you. I didn't heal her. The doctors don't heal her. We have this divine gift to self-regulate and heal. We have this divine capacity to self-regulate and heal.
Yes.
And that's the part that I feel so good about because, we have this God-given ability to regulate and heal. We just need to eliminate the interference and restore coherence so that everything kicks in. Your immune system kicks back. What happens when you have an infection in a tooth? It's almost like you flip an energetic circuit breaker.
Oh, I like this. That's true.
So your teeth are like the panel box for everything. Oh, this is the dishwasher. This is the refrigerator. These are the bedroom lights. These are this. So your teeth are like the circuit breakers for your energetic immune system.
Oh man, that's good.
So what happens when you have dis-ease is you pop the breaker. Nothing, I made a remark once and I said, cancer isn't the scary thing anymore. And it was a little insensitive because if I was diagnosed right now, and many people I know and loved ones and family that have faced cancer, and it's interesting because there's a book, Love, Medicine, and Miracles by this guy, Bernie Siegel, and written in the 80s. I read it when I was up at that Harvard program. There was a book, Love, Medicine, and Miracles. It talked about the people who really thrived and cancer went into remission versus those that didn't. And a lot of it was psycho-emotional and spiritual connection, those last two levels of regulation.
Yes.
So being regulated up here and here is even almost, in a sense, more powerful than down here. But all that happened with Lisa was popping the breaker back on and allowing her immune system to kick back in. And, there's a dysbiosis that goes on, right? There's a lot of talk about every cancer has a pathogen attached to it.
That's right.
So when I say cancer isn't that scary anymore, no, it is scary. Psychologically, it can be terrifying. But that's part of your walk is to get over that fear. Part of your walk, faith is the opposite of fear.
Yeah.
And faith is the gift that we have to manifest. That's how we manifest. We manifest with faith.
That's beautiful. Yeah.
And that's the most coherent level that we can have. That's why my editors are fighting with me because they were like, well, it doesn't sound dental, the coherence code. It doesn't sound dental, and I really want to go with it because it's a powerful concept because it transcends just us. It transcends our being together. It transcends our existence on the planet, our relationship to the planet, not just to each other and ourselves.
Well, you're not just a dentist to me, quite frankly, Dr. Jerry. You're much more. You rehab the entire body through the teeth. And like you said, they're the little breakers you're flipping, and the living room, the kitchen that it's working on are the different organ systems of the body, right?
Yes.
So it makes a lot of sense to people when you say it that way, right? Because these meridians, that's how the teeth represent, like the foot, different organ systems, right? So each tooth is attached to, the endocrine, the heart. This is why when you hear about teeth and infertility and cardiologists give you antibiotics before you go get your teeth worked on.
Right.
It's because the teeth represent everything in the body, right? It is whole body connection. So if you're a dentist and you don't know that, you are barely scratching the surface about how to practice, in my opinion.
Absolutely.
You
When
know?
I came out of dental school, the number one reason why dentists were sued was because they were so myopic that they only looked at the teeth. So they were sued for failure to diagnose gum disease because they didn't even look at the gums. So it's failure to diagnose periodontal disease was a major thing. Like patients would be going to the dentist and they're getting a cleaning and the dentist is checking them. And then about 10 years go by and they're like, my teeth are moving a little bit. My teeth are moving. And the dentist is like, oh yeah, I got, teeth shift. And, there's that. Then it was like, oh, this one is loose actually.
Oh, wait, you missed this one.
Like, it's like failure to diagnose periodontal. They had advanced gum disease with bone loss, but it wasn't just about losing teeth or bad breath and losing teeth. Gum disease gives you a 10 times greater chance for a heart attack, 7 times greater chance of adult onset diabetes, 67% higher incidence of pancreatic cancer, much higher connection to Alzheimer's and neurodegeneration, the number one bacterium, colorectal cancer, lung cancer, breast cancer, 2.5 times higher incidence of breast cancer. So you have literally gum disease being the body's number one source of chronic low-grade inflammation that dysregulates organ systems and everything all over, and leading to cancer. Gum disease, so big study came out in 2015. The headline was, "Gum disease is a precursor to cancer," because of inflammation, this issue of changing genetic changes in a more pro-inflammatory genotype is all from this chronic low-grade inflammation. So low grade, it's a silent killer. It doesn't hurt,
Undiagnosed.
undiagnosed,
Yep.
and so it is a slow progressive killer of teeth, but really massive ravaging in the body from chronic low-grade inflammation that doesn't get treated.
It's like death by a million paper cuts.
Yeah.
Slow, right?
Yeah,
Absolutely.
good analogy.
So unfortunately so. So really, really having emotional regulation and having your nervous system under control is extremely important for inflammation too. So I want to bring that back.
Absolutely.
And what I'm hearing you say is the mouth is really, depending on if it's good or bad, can be connected to cancer. It can be connected to infertility, to cardiac disease. Do you see it connected to autoimmunity?
Absolutely, 100%.
Really?
Rheumatoid arthritis is a huge connection.
Yeah.
A huge connection to periodontal disease, low grade, and people can Google this. There's studies out, thousands of studies that have showed this correlation, this alignment. And unfortunately, and to kind of get back to what you were saying, like, do you see dentistry needs to evolve? I mean, yeah, because we think about it. I mean, let's just talk about fluoride.
Oh, yeah.
I think to throw that out, the whole issue of fluoride, and it cracks me up because organized dentistry goes around saying, fluoride is the greatest advance of the 20th century. Then recently, I was debating, and I've been a member of the American Dental Association from when I came out of school. I mean, I support organized dentistry. I love my profession. I love dentistry. I was definitely called to this, and I love this, even though we've been made fun of in TV and everything. It's always like Jerry the dentist was like the wacko guy on Bob Newhart or even on Seinfeld, the dentist was the wacko, and this and that. So we've always been made to be the kooks and but the reality is that, dentistry, to be a good dentist, I always say, you need the 3 H's. You need a good head, you need good hands. It's one of those, you need good hands and you need a good heart. And dentists see patients on a more regular basis than any other healthcare practitioner.
That's right.
Even
Every
more
3
than
months.
chiropractors, more than the dentist, the whole preventative program of, going for checkup and cleaning and that kind of thing. You have this contact with the patient. It's also a very intimate, you're close to the patient, you're working in their mouth.
Yep.
So it's a very intimate thing where there's a lot of transference and countertransference, but there are just so many practices that we've done that we've defended, heavy metals, amalgam fillings, 52% mercury. They came out at the end of the Civil War and we defended it. Why? Because it's cheap, it's easy to do, it stays in the mouth for a lifetime. A monkey could put an amalgam filling in. And then when I came out of school, I used to see some patients, I actually saw like, what are those grooves on the top of the filling? It was the thumbprint of the dentist putting the amalgam in because they didn't wear gloves.
Oh my God.
And they'd be sticking it in. And a lot of dentists would go, oh, yeah, let me just stuff that in there.
Oh, my head's gonna spin around backwards. Okay.
52% mercury,
Yeah.
the
Not
most neurotoxic element on earth. And then we were told in dental school that the mercury stays magically locked in, and it doesn't off gas. And I was on the Dr. Oz show in 2011, and they actually had an amalgam tooth and a toothbrush on the top, and they were measuring the mercury vapor coming off of the tooth.
it's a good
So they're like, well, dentists go, I've been doing amalgams for 35 years and my patients are fine. And I'm like, first of all, how do you know they're fine? What's going on subclinically? Oh yeah, they take thyroid medicine. Oh yeah, they have hypothyroidism. Oh yeah, they have a lot of gut issues. Oh yeah, this guy got MS. So who are the ones that get the real neurodegenerative issues? Are the ones where you have this APO4 genetic variation, which
for
is
Alzheimer's.
they can't chelate.
Yes.
So we have the ability to chelate. So even though amalgam is a bioburden, we chelate it out. So we're not we're not walking, or we're not with MS, God forbid, or Parkinsonism. A lot of dentists, by the way, those that have that, because I think it's like 16% of the population have that genetic variation,
Yes.
the APOE4 gene. just like MTHFR, which will,
Alzheimer's. Yeah.
and MTHFR is the one, pro-inflammatory genotype, and can't methylate. Um, so we have Leno, dental amalgam should have been banned a long time ago.
I agree with you. And the
And
ADA
it's,
is just now catching up.
yeah, I managed with a Dr. Mark Wolf at NYU, who was one of the chairmen of the department, a great guy, and he got amalgam taken off the floor of NYU from not being used. But that's only half the issue.
Mm.
The biggest problem with dental amalgam is people who have it and it leaks and you get decay, teeth break because a metal filling is like a wedge splitting a log. When you get decay under it, it's like you bite on something hard, it just splits the tooth. So amalgam is not a great material, even though it stays in the head for a lifetime, but
It's leaching with hot liquids.
52% mercury, methyl mercury. You have the biggest issue is the greatest amount of mercury exposure. Here's the paradox: you got to get it out, but if you don't take it out safely, you expose the patient, your dental assistant. As a matter of fact, if OSHA went into a dental office when a dental amalgam was being drilled out unsafely, there would be unsafe levels of mercury vapor, not just in the operatory, but in the hallway and possibly even in the reception area. Like I was on the Dr. Oz show, he held a thermometer and he said, if I drop this thermometer, we will have to evacuate the studio and all of you, 100 people in the audience or whatever. And he said, yet dentists are using this material all the time and they're drilling it out and da-da-da-da-da-da-da-da. And he got a lot of heat. The American Dental Association went wild.
Flipped out, yeah.
They flipped out because the American Dental Association was founded in the late 1800s as well by, guess what? Pro-amalgam dentists.
You mean there are conflicts of interest?
The American Dental Association had the first patent on dental amalgam. There was something called the Amalgam Wars, where dentists who were against the use of mercury and dentists who were like, amalgam's great, it's the greatest new material. Because if you go back into the history of dentistry, they actually put lead in teeth around George Washington's days. So I guess that was an advance.
Wow. Yeah, talk about some reduced IQs, I guess, huh? Right?
So, so you have dental amalgam, you have endodontic therapy, modern endodontic therapy, which I'm not against. I just think we need to move into more regenerative types of procedures in the world of endodontics, like regenerating pulp, stem cells, pulpal regenesis. That's the direction we need to go, not taxidermy.
Right.
We need to move in the other direction. Or if you need to do a root canal, monitor that tooth and look at it as an interim procedure, not as, oh, you could have that root canal for 40 years. That's not true. I mean, not with the bacterial and the biologic studies that are emerging.
That's right. I think they last around 8 to 10 years.
That's about it.
Yeah, they really
I
do.
was saying 7, but
Yeah.
that's a study in itself. But if you think about it, you have 41 million root canals being done. I think 28 million in the United States alone a year. And the United States, a root canal isn't a cheap procedure, by the way. It's $2,000 to $3,000. And a lot of times, you have 21 million root canals being done, $2,000 to $3,000 a root canal. You're talking about, this is the livelihood of endodontists.
Oh, yeah.
You're talking about trillions of dollars of revenue for a procedure that is temporary at best.
It's really hard to get a man to see the problem with something when his living depends on it. It's the truth. That's the problem right there.
Well, that's why there was a documentary film called The Root Cause.
Oh, and they pulled that right off of Netflix.
They filed a class action lawsuit. So the American Association of Endodontists, a very wealthy organization, they filed class action lawsuits saying it was causing unnecessary harm to the public. And I watched it, and there was nothing undocumented, or it was very well done. And the producer, who was the patient who experienced the problem, because it was a true story about the guy who his whole inflammatory system cascaded down when he had a root canal.
I mean, I have to thank that film because that's what woke me right up about missing something with my Lyme and mold patients. Because I know, if someone is a continuous fight with Lyme or mold or something like that, and they have issues with the teeth, cavitations, root canals, that is a roadblock to their healing.
Yes.
And that movie is what woke me up to that. So I am so glad that I watched that on YouTube after they pulled it.
Yeah, and you know what? They filed it against Amazon. Amazon couldn't do it. Netflix couldn't do it. I think you can get it online. YouTube even pulled. They had to do that. I mean, talk about censorship. This was major censorship. And, Netflix didn't want to deal with the lawsuit. Amazon didn't want to deal with the lawsuit. So it was all, pulled down for those reasons, not because things were incorrect that were on there. Everything was very clearly researched and referenced,
Yes.
but there was no disproving what was done. Now, some of it was sensationalized in the dramatic, what do they call it? In a dramatic way it was presented.
Yeah.
They had him walking on coals, but it was a front tooth. What meridian is that? It's the genital urinary system.
Bladder.
So he was having problems with sexual performance with his girlfriend or his wife, or I forget, I think it was girlfriend. And it was like there's a scene of him in bed and he's just like, so
Yeah, when that
distraught.
happens, men actually do something
Yeah,
to
they
help.
distraught. He was distraught. But it was on it's on the prostate for men, it's on the uterus for women, right here.
Yep.
I have a man who had metal implants. So metal implants, titanium implants, which we thought were great. I did my first dental implant. They're inert. There is corrosion, there is inflammation, there is endotoxin production. Basically, the bone that grows around a metal implant is almost like scar tissue bone. We call it sclerotic bone. It doesn't really have a good blood supply,
Mhm.
and but the implant itself, saliva is like a weak electrolyte, can corrode the metal implant.
Like a battery.
Right. So you have corrosion, and actually a study that came out of China showed
Wow.
titanium particles from dental implants being deposited in the liver, the kidneys, and the lungs. So I just had a man who had a virtual consult with me from Barbados. He had a 3D cone beam, and I read it. This man is in kidney failure. He is loaded with implants in the front of his mouth, several of which are infected, and the bone being lost around others, and all of this stuff. And it's like, okay, where's the kidney failure coming from?
See, things are not known of unknown etiology. When we dig deeper, there's always a root cause, whether we find it or not, for
Right.
sure.
I remember unknown etiology was always the term we used when we couldn't figure out what was going on.
That's exactly what it's still used for. So, as we wrap up here, Dr. Caratola, I would love for you to leave everyone listening out there with a pro tip or a good tip of information about their teeth and something that leave the audience with about how important.
I think, I can use my standard line, be true to your teeth or they'll be false to you. What's really amazing is that, be aware of the shadow of your smile. The shadow of your smile is that, and I get people who come in and they want cosmetic work and I love cosmetic dentistry. Half of my brain is artist, and,
Mhm.
but the important thing is that inflammation is so essential, and you really need to look at your mouth as a mirror and a gateway to
Mhm.
health in your whole body. And ask the right questions when you go to the dentist. If your dentist gets defensive, if your dentist is um, not able to answer those questions, then it might be time for you to find a new dentist who is open to that. And for anyone who's watched your show today, if they want to have a virtual consultation or something like that, I know you can. We'll give them a link
Yes.
and we will give them a special promotional code to get a discount. And I also wanted to
Yes.
I also want to let them know that Revitin,
Mm.
Revitin, we have a discount code. It's Dr. Curatola 20.
Yes.
It's DRCURATOLA 20. And
It's
by the way,
good, you guys, if you haven't tried it. It's delicious. Yep.
and if any of this information today that we shared, and we can talk forever, if any of this information, I'm putting it out all the time, out on my Instagram at
Yes.
Dr. Jerry Curatola. Jerry with a G, because I'm a Gerald.
That's right. The older book, Mouth Body Connection, obviously I own this, but your new book, The Coherence Code,
That's later this year.
we'll have you back then.
Awesome.
Thanks so much for coming. Yes.
Pleasure.
Thank you. If this episode spoke to you, subscribe and share it with someone who can't find answers to what ails them. Please consider leaving a review. It helps others find our podcast. And download the Wellness Care Plan I've made for you for free on my site, wellnessplus.com.